For novel pathogens such as novel coronavirus, MERS-CoV, or avian influenza, the recommended additional precautions are airborne, droplet, and contact precautions.
Huples cat. So I'm going to do a video on putting on actual medical PPE in the right order, but I'm not doing the video. I'm using an actual hospital video, but I'm going to stop it all the way through it and say what I think is good or what I think is bad about the procedural steps. I am absolutely going to do improvised PPE, but you know what? This will take far too long, so I'm going to show you how to do it properly using proper medical equipment for personal protective equipment, prior to then showing you a video probably in a few days on how to actually improvise it in ways that are not 100% effective, because we like to buy things and use them single use, but would be reusable and would give you an added measure of protection, but also talk about the problems using improvised PPE. And I'm hoping none of us ever have to.
These require you to wear the following personal protective equipment: gown, fit tested, seal checked, N95 respirator.
See my video on how to actually do a self-testing fit test for a N95 or higher mask. It's very important it fits your face. It's very important you don't have facial fungus.
Face shield and gloves. When donning PPE, perform hand hygiene for 15 seconds.
So the hospital uses evidence-based practice and they're saying 15 seconds is good enough. I'm saying 20 seconds because, let's face it, some of us have bigger hands than other people, and I also believe that you should use soap and water instead of the alcohol sanitizer wherever possible. Their point here is that you're putting on protected personal equipment, so they don't actually want you to get involved in the time it takes to use soap and water and drying, because the idea is you're going in to deliver care. So that's why hand sanitizer is going to be pushed in this video.
Apply 1 to 2 pumps of alcohol-based hand rub to the palms of dry hands.
2 to 3 if you have adequate supply of hand sanitizer. 1 if you are short of hand sanitizer, and 2 if you probably have enough hand sanitizer. Again, your hands should be very clean when you're putting this stuff on. And one of the short steps that a lot of nurses use is wearing vinyl gloves and just using a little bit on the outside of the vinyl glove. It's not recommended.
Rub hands together, rubbing palm to palm, in between and around the fingers, on the back of the hands, as well as the fingertips and nail beds.
This is absolutely critical. Doesn't do a lot. You're not sterilizing your hands with the chemical. There is an effect from that. What you're really doing is you're rubbing any loose skin off, and you're also using the friction. And the friction from a dry hand towel, which is single use, or a paper towel, which is single use, is one of the great ways of drying your hands after soap and water. Again, they're using alcohol. You want it to air dry, and you don't want it to air dry like this.
Continue rubbing until hands are completely dry. Hand hygiene using alcohol-based hand rub is the preferred method. Use soap and water only when hands are visibly soiled.
If anybody out there works in healthcare, they'll know what I'm saying is true. When you are frequently washing your hands, as often as healthcare professionals are doing so with soap and water, your skin will actually start to deteriorate. If you have open sores on your hands, you actually shouldn't be using PPE. You've broken the skin barrier. Virus on my skin does nothing to me unless I transfer it to an open mucous membrane. Okay? But if I have a break in the skin, there is a possibility of viral transfer directly from the break. And you're also putting the patients at risk, because when you have a broken skin membrane, you're actually going to shed material into the patient.
Tie back long hair if applicable. Do not bring unnecessary equipment in the room. Inspect your equipment for any damage prior to donning each piece.
If you're doing home quarantine, whatever's in the room before you put the person in there who you think's infected or you know is infected by their symptomology, make sure there's nothing in the room that you need. Anything in that room stays in that room. Now, if we want to start talking about nursing care for multi-casualties, ideally you don't share, but in reality, in SHCF, in your home, multi-casualties will be nursed in one room and treated as one patient effectively. Yes, that will risk cross-contamination between the patients, but I don't really know how else you'll be able to cope with more than one person if you're trying to do all this with them and keep them hydrated and keep them clean and keep them physiotherapy and all the rest of the stuff you're going to have to do if you decide to treat.
Clean shaven, Don your gown. Tie around the neck and around the waist. Secure gown using a bow that can easily be untied. Ensure all clothing is covered by gown.
So if you can use a paper or plastic painter suit, you would put it on at this stage, and I'll show that when I'm doing it. And the same principles apply. You need to be able to easily remove it without contaminating the inside, and you need to be thinking what you're doing. And I'm actually going to show it with the painter suit and also with a plastic bag. I do recommend trash bags for home use. I think they're by far the fastest, cheapest and easiest method of providing a gown in the home. Bear in mind, none of these gowns are used in hospitals apart from very, very expensive operating room gowns are actually waterproof. So if the person's got liquid diarrhea or vomiting or sweating profusely and you're moving them and touching them, which you should be if you're giving them nursing care, you could actually break the barrier of the gown. The gown is just basically to say, hey, they're covered in sticky jam. I don't want any on me. It's okay on the gown.
Lift your chin and place your fit-tested N95 respirator over your nose and mouth. Stretch the bottom strap over your head and place it on the back of your neck. Ensure strap is on bare skin only, no loose hairs. Place the top strap on the crown of your head. Ensure that the straps are not overlapping or crossed. Check if mask is properly formed to face. Ensure no fold by running fingers along the edges of the mask.
This is where it becomes really important to have a second person to actually observe you, or a full-length mirror, and take the time to actually look in the mirror. You'll notice from the video it's still crossed. Now the way it's crossed you don't really feel it, but what will happen over time is it can cause pressure ulceration, which is where you lose blood flow to that part of the skin, and it will become an ulcer and start not doing very well. There's plenty of pictures of the poor Chinese nurses and doctors right now showing ulceration on their face from overly tight face masks or face masks that have been left on too long. It's a risk you're going to have to take if you're providing care.
Mold the metal nose strip to conform to the shape of your nose. Do this by placing both your middle fingers at the bridge of your nose and use your index finger to press along the edge of mask along for the sides of your nose into the cheeks, creating a good seal. Repeat pressing index fingers with pressure especially alongside of the nose. Perform a seal check by placing your hands at the side of your face at eyebrow level without touching the mask.
Very important if you're wearing fitted goggles, because you won't be able to tell that it's leaking. So this is a good idea. If you're wearing glasses like this, and a lot of people will in these circumstances, you'll probably notice fogging. Any fogging at all on expiration, on breathing out, it's not functional. It's better than nothing. So if you can't get a perfect seal, it's better than nothing, but try to get a perfect seal. And that involves using this equipment now when you're not stressed and having a good play with it, and exercising and doing things in this equipment that you would be doing in reality. Just sitting there in a chair with the mask on is not fit sealing it nor testing it adequately.
Exhale quickly once to check if air escapes the mask and hits the palms of hands. If you feel leakage, readjust the fit of your N95 respirator and perform another seal check.
If you have enough masks, take it off and restart. Most procedures in healthcare, if we hit a problem during the procedure, if it's not time critical, the best advice is to stop, remove, restart.
Don your face shield by placing the strap at the back of your head. Ensure that the top of the face shield is resting in the middle of your forehead.
Sound advice for droplet? Terrible advice for airborne. If you think this is airborne, please have sealed goggles without holes in around your eyes. Use that instead of the face shield. And for critical procedures, like if you're putting an airway tube into a patient, I would recommend both. My hospital assures me it's droplet. I will be carrying this for myself and this for my girlfriend, who works in level 3 ICU and is a rapid response nurse. I'm a hospital manager, I have to go to all codes. I'm not taking the risk that this is airborne or can become airborne during intubation. They can reassure us all they like. The Chinese healthcare professionals, who, let's face it, know what they're doing and have the most experience, say it is airborne, at least partially airborne.
Put on your gloves. Ensure that gloves are placed over the cuff of the gown so that the skin of your wrist is not exposed.
If you do have forearm and upper arm exposed, for example when I use my trash bag technique, you'll see that the forearm is actually exposed. What it means is at the doffing stage, when you take it off, you have to assume that's got contamination. So the hand washing would actually then involve here and then here.
Perform a final personal protective equipment check prior to going into the room.
Now I know a lot of you are going to wrap yourselves in duct tape. There's no need for that whatsoever. This is not nuclear, biological, chemical warfare. This is biological warfare. As long as it fits, there's no need to actually exclude the airflow that's going to happen. It's not really going to happen. You're not really going to get viruses coming in and going up here. Whereas in a radiological or a chemical event, absolutely, duct tape one pair of gloves, put a second pair of gloves on, duct tape it. And there again, I would actually use 2 pairs of gloves if you're using knives or if you're using very, very invasive procedures on the patient who you know or strongly suspect has coronavirus and is very, very sick. It's very easy to tear gloves. Out of interest, for those people who don't know, gloves are estimated to be 60 to 70% sealed. Okay, so there is actually air and viral transfer through glove material normally, and we're aware of that, which is why you have to wash your hands after you remove the gloves. It just limits it massively, and importantly in healthcare, stops feces, poop, Steve Foco, and blood from actually getting onto your skin, which, let's face it, is not that pleasant. Happened to me a lot. I don't really care, to be honest, just wash it off, but it does tend to freak people out if you're not used to it.
Alternatively, have a colleague perform the final check. After entering the patient's room, keep hands away from your face.
Face, mask, gown, hair, legs. Keep your hands like this. Like literally. Keep your hands like this the whole time that you're contaminated in a contaminated area. You are contaminated as soon as you walk in that area. You have to assume that your hands are most likely to be the most contaminated. So take it really seriously.
Only open one door at a time to maintain negative pressure in the room.
Okay, that's it for putting the medical PPE on. Just want to say about the negative pressure rooms. You can construct negative pressure in your own house, use plastic sheets and tins, and you do this sort of thing. Or if you're technologically able, you can actually make a little pump. I'm not really convinced it's needed. What I really don't want is airflow. So pushing doors open rapidly. Basic plastic painter sheets on both sides of doors that aren't going to contaminate you, so you have to think about where you're placing them, actually really reduce the possibility of airflow out. In this case, we don't want the air around the patient to get into the other areas because they're the ones with the infection. Now, people who are leukemic, if you have a leukemic child and you're not able to get medical treatment for them because of a healthcare emergency or an SHTF, you actually want to do the reverse. You want to make sure that the air that you have in your home and on you doesn't go into the patient's room because they're going to get the infection and then die because they have no white cells to fight it. But that's an entirely different matter altogether. And if you have a leukemic child, you really need to do your own research. I know I sound like a flat earther, but you really should do your own research. Everybody should. So that's it for this video. I don't want to make a 30-minute video. The next one will be on how to doffing, taking it off. So now you know 2 new words. Donning is putting it on and doffing is taking it off. I think it comes from medieval England, but somebody can fact check me on that. Toodles. That was a Bad Terrier 2020 production.